Hi, my name is Jawan Jabara. I'm gonna talk about cleft lip and palate. Cleft as a definition is a fissure or a gap. It's one of the most common craniofacial abnormalities. It can be cleft lip alone or cleft palate or both مع بعض. Cleft lip occurs as unilateral, incomplete or complete, or bilateral, incomplete or complete. Cleft palate varies from incomplete cleft palate involving just the soft palate to unilateral or bilateral complete cleft lip and palate. Cleft lip or cleft lip and palate are more common in males, أما cleft palate لحالها is more common in females. What about the etiology? It's mainly multifactorial. Can be congenital, environmental, ممكن تكون Barton's syndrome وفي familial tendency. إذا كانت environmental ممكن بسبب viral infection مثل HIV or CMV، ممكن بسبب medications مثل steroids or anticonvulsants، ممكن بسبب smoking and drinking alcohol during pregnancy, or if a pregnant lady exposed to X-ray, especially in the first trimester. Regarding the familial tendency, having an affected parent can increase the risk, and there is a 10 to 30% increase in the frequency if there is an affected sibling. Now I'm gonna show you some pictures about all these different types, starting with the unilateral cleft lip. As we said, it can be complete or incomplete. We can see here the connection between the lip and the nose in the complete type, and here there is no connection between the lip and the nose. Bilateral cleft lip also can be complete or incomplete. There is different types of palatal cleft. The submucous type. Here the mucosa is normal, but the underlying bone is clefted, so clinically we cannot see the bone cleft because it's covered with a normal mucosa. The soft palate cleft. Here we can see that just the soft palate is involved and the hard palate is normal. The unilateral cleft lip involving both hard and soft palate, and the bilateral complete involving both the hard and soft palate also. Cleft lip and palate together. As we can see here, a unilateral cleft lip with a unilateral complete cleft palate, and here a bilateral cleft lip with a bilateral complete cleft palate. How we can diagnose these abnormalities? It's mainly by physical exam, but today we can use ultrasound prenatally for early detection. How we can prevent and treat these abnormalities? We can prevent it by folic acid supplement before conception and for the first 2 months after. Regarding the treatment, it's mainly multidisciplinary, including oral and maxillofacial surgeon, orthodontist, speech therapist, ENT surgeon, and psychologist. Usually, we provide the neonate patient with a dental obturator, like we can see here in this photo, to facilitate feeding. If these abnormalities are not corrected, it can lead to dental problems like crowding, spacing, multiple missing teeth, and other problems. Also can lead to ear infection and possible hearing loss, to feeding difficulties, low self-confidence, and speech problems. Now I'm gonna show you some clinical cases. Starting with this unilateral complete cleft lip. This is before the treatment. As we can see here, we have a unilateral complete cleft lip, and this is after the surgical treatment. Another case, a 16-year-old female patient presented with the absence of the premaxilla and bilateral complete cleft palate. We can see here the absence of the premaxilla. The management of this patient included ortho surgery and prosto treatment. They started with the ortho treatment. Here we can see the rapid maxillary expansion screw to expand the maxilla to provide space to replace the missing teeth. And then they did the surgical part. They did bone graft to replace the missing bone in the palate. And then they did the prosto treatment. They gave her a prosthesis that replaces all the missing teeth. And this is the photo post-operative and the post-operative panorama. Another case, a 6-month-old female child brought by parents for correction of her lower lip deformity. By physical exam, they found that she had a median cleft of the lower lip extending from the vermilion to the midolabial sulcus, and intraorally there is ankyloclossia with intact mandibular surface. This is the ankyloclossia, and this is the preoperative radiograph. She was taken for the surgery under general anesthesia. They started to correct the cleft lip. They did a V-incision over the skin and the mucosa to correct the cleft, and then they moved to correct the ankyloclossia. They released the tongue from its attachment over the alveolus and the floor of the mouth. Then they checked the mobility of the tongue, and the defect was closed. This is the patient post-operative. We can see there is no cleft in the lower lip anymore. And that's it. Thank you for listening.